Okay, so today we're going to be demonstrating some pin and stretch techniques, which is a way of lengthening the muscle belly and decreasing the tension. So to start with, we're going to be doing pin and stretch on the scalenes, the anterior and middle scalenes. And the approach that we want to take is we're going to be starting at the insertion and then gradually moving to the origin. So this is a passive pin and stretch. So first I'll locate the muscle approximately where it attaches, there on the second rib. Shorten the muscle by bringing the neck a little bit into flexion on that side. Applying pressure, not too much, and then moving the head to lateral flexion on the other side, which will lengthen the muscle. It should be a slow, steady process. Never applying more pressure than is comfortable for the client. You're not holding the stretch for a great length of time. So now we're moving to the middle scalene. Same thing at its insertion. Apply the pressure. Lateral flexion to put stretch on the muscle. Transition to another point. And then again, lengthen the muscle. Good. Once you've finished, it's a good idea to do a flushing stroke in the area. Next, I'll be demonstrating pin and stretch on the SCM, the sternocleidomastoid, which sits just here. To lengthen this muscle, we'll have to be turning the head to the same side. So with this muscle, you cannot compress it against the hard bony surfaces underneath. You have to apply the pressure by just gripping the muscle. So as you can see, I've gripped the muscle, I apply a slight downward pressure to it, and then rotate the head to that side. Reposition, again, a little tension on the muscle belly. Rotate the head. It's not uncommon for this muscle to pop out of your fingers while doing this action. Make sure you're checking in with your client to make sure that the pressure is all right. Good. And again, you'll want to do some nice soothing flushing strokes at the completion of this. Next will be the trapezius muscle, upper trapezius fibers that we'll be working on. So again, you're going to follow the belly of the muscle down to the insertion. Apply pressure and a little bit of tension to the muscle belly. And then in this case, we'll bring the head into lateral flexion. A nice, slow, steady pace is important. Nothing too quick. And it's important to hold the pin all the way through the movement. So while lengthening it, and then while bringing it back short. Good. Okay. So the next set of muscles that we're going to be doing are in the chest, the pec major and pec minor. So it's important that you have the client on the edge of the table so that you have full range for their arm. So Jackie, I'm going to have you move over until you encounter my hands. There you go, and stop there. So again, it's important to get to fully support the arm while you're doing this particular one, because you don't want the lower arm to be flopping. So again, you're going to apply downward pressure into the belly of the pec major muscle, apply a little bit of tension, and then you're going to take the arm, the shoulder, into abduction to lengthen the muscle. Again, reposition, push down, tension, lengthen. And you want to move through all of the fibers of pec major and then move to the other. So you're doing in sort of an arc shape as you go. Because this is a wide, broad muscle, it does take a little bit longer to cover all the fibers from insertion to origin. Good. Okay, the next muscle that we're going to be demonstrating pin and stretch with is the pectoralis minor muscle, which runs at an angle here. So in order to be able to fully lengthen this muscle, it's important to first bring the arm into 135 degrees of abduction. So when you apply your pin and stretch, or your pin, you're going to be pinning the muscle against the 3rd, 4th, and 5th ribs, which is where it attaches. So you apply downward pressure, a little bit of tension, and then bring the arm into full flexion, reposition, and again into flexion. Working the full length of the muscle from the insertion to the origin. The next muscles we'll be doing will be the bicep. So to do the bicep, you want to make sure that you bring the arm into slight abduction. Now there is one area of caution when doing the pin with the bicep. You want to make sure that if you feel a pulse under your hand when you apply pressure, that you move a little bit more laterally to stay off the brachial artery. And apply downward pressure. So you'll apply your pressure, lengthen the muscle, apply pressure, tension, lengthen the muscle. The next group of muscles will be the wrist flexors. So again, you're going to apply pressure to the belly of the muscle and then bring the wrist into extension. Again, new position, apply pressure, tension, extension, pressure, tension, extension. Again, when you reach the wrist area, you want to be careful not to apply pressure directly to the carpal tunnel, as you don't want to apply pressure to the median nerve. So next, then we can do the wrist extensors. So again, you'll bring the wrist into slight extension, apply pressure, tension, and flex the wrist. Good. There is another way that this can be done in an active way, and that involves gripping the forearm with both hands and having the client flex and extend their wrist actively. So they'll go through a full action, and then you reposition. This particular technique works both the flexors and extensors simultaneously and requires the client to actively participate.